In this video, we'll be going over the proper heating instructions for the upper and the lower trays. For future reference, you could always refer to the instructions for use for specific directions. What's needed is hot water. Temperature of the hot water should range between 120 to 130 degrees. Once you get temperature of the water to be where you need it to be, place one of the arches, this one being the upper, into the hot water for about 20 to 30 seconds or until you see that it's transparent. What you'll see is the color of the trays will go from white to a transparent color, letting you know that it's ready to be worked with. To better work with a tray material and easier to work with and handle, you want to take a Vaseline and you want to put a little bit of Vaseline on your fingertips so that's easier to maneuver and manipulate the trays and doesn't stick to your hands. If you look closely, it's been about 10 to 15 seconds and the tray material is starting to become clear. When it becomes clear, it is ready for you to work with. You can form it by taking your finger that now has Vaseline coated on it and size it according to what the patient's mouth is. And it'll allow you to easily manipulate it and move it around without sticking to your hands. When you place it in the person's mouth, you'll take your fingers and you'll manipulate it closer to the gums and having the person suck inwards, creating a better form. You'll repeat the same exact step with a lower tray. With the upper tray properly warmed up and ready to be molded, you want to manipulate it so that it fits around the patient's arch. Insert it in there while it's still warm, putting pressure on the lingual side and on the distal. Have your lips form around it. Close your lips around it. Close down. And let the patient get a good lip seal and suck inwards and lift your tongue up towards your palate. Leave it in there for 20 to 30 seconds or until the arch is no longer transparent and has a white milky color to it. Having the patient continuously put your pressure of your tongue to the roof of your mouth. Once it's started to set in there, going open, you can assist the patient in molding it around the upper teeth. If you can see here closely, you'll be able to see that it's already started to take shape of the arch, noting that the handle is centered to the midline, referencing to the nose. Once 20 to 30 seconds have passed, go and open. You can release it by putting pressure in the back and placing the now formed tray in cold water to let it sit. The next step is to fit the lower tray to your patient. Following the first steps of warming up the lower tray, as you did with the upper, you want to take the lower tray in while it's still transparent and get it prepped to be seated. The way you can tell this is the lower tray is that there'll be pads going over the occlusal surface. With it still being transparent, and again with Vaseline on your fingertips, you're able to form it nicely and get it prepped to go around it. The instructions you give the patient is critical. You want to lift your tongue up, get the tray seated, and with their tongue up, you want to seat the tray down, guide it into place, guide the lingual side in, have them go ahead and rest onto that, making sure the midline is centered to the nose, lifting the lips up and going around it and having the patient close down, create a seal, sucking your lower lips in, pushing your tongue down and forward. You want to leave that into the mouth for about 20 to 30 seconds. Again, keeping an eye to make sure that this is centered to the midline. Once 20 to 30 seconds has passed, you can go ahead and open and continue to contour and mold the rest of the trays around the teeth, making sure a good fit both on the lingual and on the buccal sides of the teeth. Go ahead and close. You want to keep that in the patient's mouth until it is clear. While it's still clear, it should start to turn a white milky color. When it gets to that white milky color, it's no longer able to be formed. It's now starting to set. You can then initiate it and begin to remove it. Or if you want additional undercuts, continue to keep it in there until the entire arch is no longer clear and is more of a white milky color. Once it's set, go ahead and remove it by pushing up in the back and lifting up slightly. And you'll notice that it's taken shape already, and you can put it in cold water and it'll turn to that white milky color. Once the tray is formed and you have that semi-custom fit that you're after, you can take the upper and the lower trays. The lower can be determined, again, based on the anterior, posterior pads and the scale that's on the handle. With the lower one in place and the upper one in the person's mouth, you can determine what size band you want to wear based on the relationship of the upper handle as it relates to the number matrix on the bottom. As you bring the person's lower jaw forward, it'll indicate which band size to use. Currently, as you see it now, that would be a band size of number 19, which is 2 hash marks away from the 21. Once you've determined that, you no longer need the safety handles. The safety handles can then be removed by just simply breaking it off and twisting it off. And the remnants, you'll have a little bit of material left over that will need to just be filed off with a burr, or you can opt to cut it with a knife or scissors to give yourself a cleaner breaking point. Once you have your trays semi-custom fitted to your patient and you've cut off the safety handles, the next step is to place the EMA bands of choice. Here you'll see a size 20 or the option for a size 21. For demonstration purposes, we're going to start off with a 21 millimeter band. What you want to do is place that 21 millimeter band with the number facing towards the outside of the buckle area. Place it on the lower button. Take the upper button, loop it around, and make sure that it's fully engaged into the EMA band. You want to repeat that step for the opposite side. Once you have the bands in place on both left and the right side with matching size, matching length bands, you are ready to insert back into the patient's mouth.